Hello, everyone, and welcome to this press conference from the Premier of Quebec, Mr. François Legault, the Minister for Health and Social Services, Mr. Christian Dubé, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier, the mic is yours.
Bonjour tout le monde.
Hello, everyone. Listen, first I wish to talk about the situation of the second wave of this pandemic. We all know we've had a second wave that started in September, specifically, and we pretty quickly reached an average of 1,000 cases per day. We have set up measures in red zones, and we succeeded for a certain amount of time to stabilize things around 1,000. There were even a few days when we were below 1,000. So we truly had the hope that it was going to continue decreasing. Unfortunately, in November, we had a second increase within the second wave, and we very quickly ended up for a few days at about 1,300 cases per day. Yesterday and today, very close to 1,500 cases. Of course, as we have already explained it, there are three different stages. There's the cases, and after that, the hospitalizations a few weeks later, and then the deaths. If we look at the hospitalizations, the 1st of October, we had 285 people who were being hospitalized. On the 1st of November, we were at 499, and now we are at 737. So we might think that with the recent increase of cases, hospitalizations will also continue increasing. And we've told you already, the situation in certain hospitals is fragile. We are almost reaching the limit of what we are able to do. So the capacity of offering people care is not infinite. Of course, the greatest challenge in our hospitals is the staff. The nurses, the orderlies, the nursing assistants, regardless of how many beds that we have, we can increase the number of beds everywhere, but it remains that we do not have enough staff. And on top of that, the pandemic has been around for 9 months, so we do have staff members who are tired. I would even say very tired. We're even at 6,600 employees who are either on sick leave or on preventive leave. 6,600. It's fewer than in the first wave, but still, it's a lot. When we look at the death toll, well, we had about the same progression. The 1st of October, we had 9 deaths on average per day. The 1st of November, we were at 20 deaths per day on average. And as of today, we have 30 deaths. Of course, all things being relative, it's 80% fewer than what we had at the time of the peak of the first wave. And there's a lowering of about 80% even in CHSLDs. It's 90% of decrease in the death toll. But still, we can all agree that 30 deaths is still 30 people that we've lost, and that is serious. Of course, the only consolation that we could perhaps have is when we look at what is happening elsewhere. Yesterday, we continued beating records, first in the world, 630,000 new cases, 12,300 new deaths. In the United States, over 200,000 new cases, 2,800 new deaths. If we do a rule of 3, all proportions kept, it's over double what we have been experiencing here in Quebec. So, still, the good side of things is that the efforts that we have made here in Quebec have allowed us to not get to such exponential increases as what we are seeing, for example, in the United States. So on that, I wish to thank Quebecers and tell you that your efforts have paid off. They are leading to results. So, when we look at the situation, we are forced to realize that it is not realistic to think that we are going to succeed in reducing the progression of the virus in a satisfactory way by Christmas. It's not realistic. And I wish to repeat, when we make our decision for Christmas, we have to first think of nurses, think of the staff that is already tired, and we also have to think about our parents and our grandparents, whom we'd like to be able to see at Christmas time. There is nobody, I'm sure, in Quebec who wishes to spend the rest of their lives regretting that they contaminated their mother or grandfather with the possible consequences that we know. So I am announcing to you today that the 2 days of gathering that were planned for around Christmas will be cancelled. That means that in red zones, it will not be allowed to have gatherings of more than just the members of your household. I'd like to remind you, however, that already what is allowed is for one person to go visit a person who lives alone. So if you're thinking of your mom or your grandfather, Quebecers do have the right to go visit alone. So the visitor has to be alone. They have the right to go see people. And even I would even ask Quebecers to go and visit those people who live alone and who are alone. It's hard. The pandemic is even, it's hard to be alone during the pandemic and even harder during the holiday period. So go one person at a time to visit those people who are alone. Of course, be careful. What does that mean? Well, it means wear a mask. It means remain 2 meters away and ideally remain for not too long. I also wish to specify that today's decision is a governmental decision. It is not a request made by public health. It is us, last evening, who made that decision by telling ourselves we have to be realistic. We have to protect our staff. Of course, since it is a measure that is more restrictive, public health is still in agreement with this proposal. Now, I understand that there are many Quebecers who must be disappointed with this announcement, people who wanted to see their families, who wanted to see their friends. Honestly, it's not a good idea. What we can see here is that the virus is present pretty much in every region of Quebec. It is in a very strong increase, and it's dangerous. There are consequences that are serious. The other thing that I wish to say is I realize quite well that the decision that we are making today is a decision that is different from what we told you 2 weeks ago. I understand that. And it's been like that since the beginning of the pandemic. Information evolves, and we try to adjust ourselves by making the best decisions. And I wish to take advantage of this moment to go over the comments of certain people in the opposition today to, saying that I give myself a perfect marks for the management of the crisis. I don't give myself perfect marks for the management of the crisis. Perhaps I should have had more experience. I see journalists here. It's true that the question often comes up in interviews, what is what you did well? What is that you should have done better? I should have prepared an answer for what I did badly. Well, now I could tell you that if we had to do things over again, I would not open the door to 2 days of gathering around Christmas. But at the same time, at the time when we made that decision, we sincerely believed that it would be possible, that the situation would improve. Things changed very quickly, but I just want to say, I'm not the kind of person who thinks that I'm perfect, as we used to say, like Réa Giguère, who will remember. I question myself pretty much every night. I ask myself, did I make the right decisions? And I talk about it with Christian, with public health, with the people who are around me. It's not an exact science, and I wish to reassure everyone. I do not consider that I'm perfect, by far. My wife could say a bit more about that. So, what does this mean? Well, it means that this year we're going to have a very quiet Christmas. We have to see things in a positive light. We won't have visitors in our homes. So when you're a little bit older, that means that you'll be able to, have naps in the afternoon after having a meal and read books, all sorts of books, and have Zoom meetings and Teams and call people over the phone. But it will be a quiet Christmas, and I think that it is important to keep things that way. As far as the request that I had made 2 weeks ago to businesses and schools to say, a week before and a week after Christmas, so from the 17th of December to the 4th of January, would it be possible to have fewer activities, to work more from home, to teach remotely? We will be keeping those measures. I think that the idea is to arrive in January in the best possible state. So to do everything that's possible to do to break the wave. So we're not going to change those measures. And to end with, I wish to say a word on the exceptional work that was done by representatives of all political parties, a commission on the sexual exploitation of minors. This is an idea that had been brought many years ago by Lise Lavallée, the MNA from Repentigny. She went to the Laurent Commission, replaced by Yann Lafrenière, who, when he became minister, was replaced by Lucie Lecourt. But there were representatives, and perhaps you've heard everybody's speeches this morning. I found it very touching because this is a subject where people worked in a non-partisan way, in a very constructive way, and now it will be the role of Geneviève Guilbeault to apply the recommendations of this commission. So I want to assure all the people who participated in this commission, it's not going to be put on the back burner. It will be Geneviève Guilbeault who will be in charge of this. And this afternoon, you'll remember, I had asked Isabelle Charret to set up a certain number of actions in order to protect the women who suffer violence. So this afternoon, Isabelle and Geneviève are going to be making an important announcement of measures that we will be setting up. So I'd like to add, or to end by coming back to the pandemic, I'd like to take an image that was suggested to me by Christian. We're in a marathon here. Those who have tried running marathons before, it's not the first kilometers that are difficult, it's the last kilometers. It's been 9 months that Quebecers have been making efforts. But the most difficult will be the upcoming 3 or 4 months. We have to continue with our efforts. We can't let ourselves get discouraged. We have to tell ourselves that the vaccine is coming, and as much as possible, we want to be at that finish line. So let's be prudent. Let's take care of one another. Thank you.
Good afternoon, everyone. We've been fighting this second wave for 3 months now. Our measures in red zones have helped to slow the contagion. We were able to stabilize the number of new cases after a first increase in September, but now it has increased again. And new cases leads to more hospitalizations. And if we continue in this direction, hospitals will start to overflow. So we have a limited number of nurses, and our nurses are very tired. That being said, I would like to thank Quebecers for all their efforts. We were able to avoid the situation we see in Europe and in the United States, so our efforts have paid off. But With the numbers we have, it's unrealistic to think that we'll be able to change the situation in time for Christmas. We need to protect our nurses and our elderly. I'm announcing that gatherings in red zones won't be allowed for Christmas. It will still be allowed to visit a person living alone, such as our parent or grandparent if they live alone. We can and we must visit them. They need us more than ever. Of course, we have to keep our distances and wear a mask. We'll keep the same plan for our schools and our businesses. This will give us a chance to decrease contagion during the holidays. I know we would all like to see our family, but it's not a good idea. The virus is very dangerous. We need to stay home and get some rest, and we have to take care of one another. Thank you.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We will now start with the question period with Elena Forel from TVA. Mr. Legault, this is a difficult decision that you just made today. But the greatest danger is, what are you going to do to get the toothpaste back in the tube? Because people will get together anyway. I trust people's sense of responsibility in the vast majority of Quebecers. As I was saying earlier on, I don't think that there's anyone in Quebec who wants to have in mind for the rest of their lives that they infected somebody from their family or one of their friends, with the possible consequences that can lead up to that person dying. So I trust Quebecers' sense of responsibility. Will there be any measures taken? Will you be reinforcing? Are you asking Quebecers? Because, of course, all of this will have a consequence on the health network. You said it. There are doctors who have been saying it for weeks, that the network is at the end of its tether. Are there measures that you will take? Or will there be announcements made for those who will still have gatherings? Yes, absolutely. But I must first count on Quebecers' sense of responsibility. I can't have a police officer in every home. But, of course, there will be fines that will be given. And we are discussing with police officers to see how we can do things around the holiday season. When you announced that the 4 days were allowed to have gatherings, you said, I wish to have a plan from wall to wall. I don't want things to be complicated because for all of Quebec. But now, if I'm not mistaken, I heard you say that it was only in red zones that gatherings were cancelled. So in orange zones, people can continue gathering? When I announced the measures 2 weeks ago, what we said was, the week, we asked people to be careful the week before, and after that was applicable to all of Quebec. But when we look at gatherings right now, and there aren't very many, but people who are in yellow zones already have the right to gather 10 people, and people who are in orange zones already have the right to gather 6 people. So that's not being changed. However, for everything else is considered, as far as red zones is concerned, because basically, apart from the northern area of Quebec, including Abitibi-Témiscamingue and the Lower Saint-Laurent, and a couple of subregions in the Laurentians in the Outaouais, everybody's in a red zone. So the vast majority of Quebecers are in red zones. But those who are in yellow or orange zones can continue having small gatherings, and restaurants also continue being open in those zones. You also said, I think it was Mr. Dubé who had said, that this week we would have guidelines concerning the CHSLDs and private residences for the elderly, so that those people can still have visitors during the holiday season. Should we understand that the same measures are going to be kept concerning the close caregivers, and there won't be more changes? Yes, and that is one of the elements that made us accelerate our decision, because we all understand the situation that in CHSLDs and RPAs is fragile, so that is why we decided to not emit guidelines for the holiday season that would go against what we just announced today. So there's no visits. No visits. we're going to be in the same scenario as we are in red zone.
Monsieur le Premier ministre, Monsieur le ministre de la Santé, Dr. Arruda. Donc, si je comprends bien, il y aura pas.
So if I understand correctly, there will be no alternative measures. You're not offering, apart from gatherings, one person who's alone can have one other person, but that's all. There's no gathering allowed. That will be authorized, and it'll be monitored. Yes, you've understood quite well. Well, how will you make sure that Quebecers do not do what you don't want them to do? Mr. Laforêt was talking about it earlier on. Once you've planted the seed, once you've told people you can get together and that you remove that, how are you going to make sure that people won't do it? I mean, you're saying that we can't put a police officer behind every person, but how can you make sure that it won't be done? Well, first, I think that without wanting to, we made an announcement that was progressive. People understood that it was not a good idea to get together New Year's. People understood that it was important before meeting another person to take one's precautions in the week before that meeting. And now we're saying, well, for Christmas, it will be the same thing as for New Year's. And by the way, that's pretty much what is happening in all Canadian provinces. We're not different here from the other provinces. Now, I think that people, I was looking at a survey, even when we were allowing the 2 days at Christmas, I don't remember the result, but there was an important percentage of Quebecers saying, I'm not going to be taking any chances with my mom or with somebody who is vulnerable in my family. So there was already a percentage of Quebecers who was saying, even if it's allowed, I do not intend on getting together with other people. So now we're, taking things up a notch. And I think it's just basic common sense. Quebecers do have a lot of common sense. They don't want to put their families at risk. We just learned that André Gagnon, the pianist, has died. Do you have a reaction? Well, listen, he was a great pianist, André Gagnon, who composed music that we all know in Quebec. He was somebody with a lot of talent and who made his art accessible as well. I'm just learning it. This is a very great loss, and I'm sad to learn it. How old was he, Monsieur Lacroix? Well, I can do research. I'll put the Department of Research on that. He was born in 1936. 36? Oh, that's pretty young.
Oui, bonjour. D'abord, une question, Dr. Arruda. Je reviens sur...
A question for Dr. Arruda. I'd like to come back to this mortality. It's clear in question of the deaths that the number of increases in the deaths in Quebec right now is superior to the number of deaths linked to COVID-19. We say that there's a yellow light lit for health, that it's a source of concern. How do you explain that situation? I would have to do even more analyses with other data to identify the possible causes. Are people not going to emergency ward as much because they're scared? I'd have to check. Well, if I may allow myself, Mr. Arruda, it's been raised for a while. Well, that's all I can answer you right now. I'm sorry. That's all I can say. I will go and check things. I will ask the experts because the data on increased mortalities can't be analyzed. We can make hypotheses, but they need to be validated. And if you allow me, while I have the mic, I'd like to take advantage to say, we're focusing a lot on Christmas and gatherings, but I think that we also have to think as of now what is happening. I don't want people to think, the numbers are pretty alarming. That means that as of now, we should be applying the guidelines that are there. If we wait for Christmas for the confinement before and after, we're not going to make the gains that we wish to have. If we really wish to save our health system, we have to lower the cases as much as possible. And I personally commit to get back to you on the data. Mr. Premier, I would like to understand. So we're maintaining the rules that had been announced for schools and businesses for the holiday period. I would like to know, were those measures made? I mean, were we closing down those vaults to be able to open the Christmas period gathering, but are you scared of the effect of those measures during the holiday period? Well, first, as I was saying, it will help us to add those measures, to have a very specific period to break the second wave even more. Secondly, there are schools and service centers that had closed, that had started to adjust themselves and adjust their calendar. The work that will be done by teachers at home. Same thing in businesses. There are businesses that had started giving holidays to their employees, that had started asking them to do more work from home during that period of time. So I think that in the context where we can see an explosion in the number of cases in the world, that we really are at the peak. Right now, we are at the worst moment in the pandemic of the past 9 months. So adding those measures, I think, can help.
Bonjour à vous trois. Tout à l'heure, Monsieur Legault, vous
Earlier on, Mr. Legault, you said that it was today a government decision being made, so it's not a decision from public health. So I would like to know, what was the recommendation of public health in that case? Well, the recommendation of public health is to say we're going to wait to the 11th of September and make a decision on the 11th of September. I'm sorry, not September, 11th of December. So what we decided is to make the decision right away, because I didn't think it was realistic to leave any hope, while also giving ourselves time to convince Quebecers, and as Dr. Arruda just said, to even start making efforts now. I think that there is a question that is clear when we look at the increase in the number of cases everywhere in the world. Well, we have to have one clear message. Let's be prudent. Let's be prudent. Earlier on, you said, to the questions of Mr. Ruby, you said that the question of the ventilation, as well as the delay in imposing masks in public cases, it was public health that had decided that. Mr. Arruda last year, in an interview on the radio, said that for restaurants, it was the government that had made that decision. Could you? Well, the two examples that were given was ventilation in schools, and I think that I asked the question many times, pretty much every week. Do we think that the ventilation in schools is a significant cause of transmission? And every time the answer of Dr. Arruda was no. So that's very clear. As far as the mask is concerned, well, once again, in the spring, for all sorts of reasons, well, first people were at home. And Dr. Arruda was telling us what is really important is that people understand, first, the importance of the 2-meter distancing. So we listened to Dr. Arruda. That is what I said to Mr. Bérubé. And Dr. Arruda also has a series of experts behind him, backing him. I just want you to understand. I also go with the recommendations of public health. I have my committee of experts, and I said, as of the first point of conference points, that things were going to be evolving because the knowledge was going to evolve, and we have to learn to walk before running. And I remain convinced that, even when people have a mask, they tend to decrease the 2 meters, whereas the 2-meter is the priority. Mr. Legault, you're saying that it is the worst moment of the past 9 months. So, is the level of concern the highest that it has been in the past 9 months for you in public health? When we look at the number of new cases every day, we are, in fact, in the peak in the United States and in Europe as well, and here. Thankfully, thanks to the measures that were set up in CHSLDs and generally speaking in our society, well, the consequences, the number of deaths, is 80% lower than at the time that we had the number of cases in the spring. Now, there's other reasons as well. On average, people are younger, it's more spread in all regions of Quebec, etc. But for sure, right now, when we look, amongst other things, at everything that is going on, for example, in the United States, what we are being told is that the upcoming 3 months are going to be the worst in the pandemic. So we have to, wrap our minds around that. It's a new way of the situation is, evolving. And we're not that far from the United States. We shouldn't think that we're on a different planet. Foreign workers, Minister Joly said we're ready to receive them if they're vaccinated. Is that your point of view? Well, every week I talk about it with Mr. Trudeau. Right now, we have postponed the opening of the borders to the 21st of January. The measures must be taken and followed very seriously for the quarantine. Now, the vaccine, we're all learning, to deal with it. Will there be vaccination booklets? That's part of the discussions that we're having, but we have not yet taken a position on that. Are we going to be treating people who come from foreign lands differently if they have a record of vaccination, proving that they have been vaccinated? We're still in that. I'd like to come back to what you said, Mr. Legault, and perhaps Dr. Arruda as well. Or the question, rather, is for Dr. Arruda. Mr. Legault said that you were ready to wait until the 11th of December to emit an official recommendation. The nuance, if you allow me to say, what I find important to understand, even though we're talking about Christmas here, is that we have a problem right now. We have an epidemic profile that is very different from the spring. In the spring, there was no community transmission as much. It went into the healthcare system, and it was a drama in CHSLDs. But right now, the virus is everywhere. It's there. So there is a potential of community transmission that is very high. A lot of outbreaks all over the place. And if we want to reduce the impact on health, because of course this affects our elderly in the residences for the elderly, etc., now is the time to act. So Christmas or no Christmas, the government decided to announce it as of now to be clear. But if you allow me, what I want to give as a message is if we hadn't talked about Christmas today, I would have had the same tone about what is happening. That is, that it's very serious what's happening right now. We succeeded in not having an exponential second wave. We went up and we maintained it, but now it's in continuous increase. And we have a fragile healthcare system. So the decision that is taken based on that, because there's the fewer mortalities, and so much the better. It's not the same groups, but there's very great community transmission. And that, the more people have contacts, the more it multiplies, more the virus is present everywhere, more it's at a risk that it will explode all over the place. And there are health systems in certain regions, for example, like in the Saguenay-Lac-Saint-Jean, it's going down again, it's going better. But the system is in peril, and if you want to, want to continue having access to surgeries and being treated for heart attacks, and it's even if you're not at risk, you might need care for after an accident, and there won't be any beds. So my message today is not that I would have waited for the 11th or 10th or anything like that. Is hey, something really serious is happening right now, and if we don't want to end up like in the United States, what we're telling ourselves is that anyway, we had said it. The gathering, the 4 days was conditional. If, and there were a lot of ifs, and now there's one if that just, ended it all. But don't wait until Christmas or the 7th of December to decrease your contacts and isolate yourself. It's major right now. We can't end up in a holiday period where people need to they need to rest, and that we end up in January incapable of treating people because our system will have been completely overwhelmed. Mr. Legault, you wanted to give Quebecers a break, but it won't take place around Christmas time. Now, the next plan for slackening of the measures is the 11th of January. That's the day that you had given. What can you offer Quebecers today to give them that break that they've been waiting for mental health as well? Well, listen, what I have to say first and foremost is that the people who are living with other people will, of course, they'll continue being able to have little parties amongst themselves. And what I'm saying is the people who live alone, go visit them. We have to visit them regularly. I'm thinking about my mother who's thinking, oh yeah? But unfortunately, we can't go any further than that. I'd love to do more, but we can't go further than that.
La presse canadienne.
Bonjour à vous trois. Est-ce qu'il n'y a pas un risque?
Isn't there a risk that during this period where gatherings are forbidden, people will leave the red zone during the holidays and they'll go to a yellow zone where things can be allowed to get together in groups? Well, it's not allowed. The restrictions that we have in a red zone are applicable if you go to an orange zone. Those people who live in red zones, so it's not allowed. Are people not going to respect restrictions? Well, we hope that there will be as few as possible. And the message that we're giving is that it's dangerous. Look at the number of deaths in the past few days everywhere in the world. It's serious. And just to clarify the rules, so you invite people to visit people who live alone during the holiday season, but there's also people who are elderly parents who live, for example, in an RPA, somebody who would respect the 14 days, the quarantine, if they want to visit their parents over the holiday period. That's not allowed for a person alone? Well, it's to go, what is allowed is for one person to go visit one person. But no, we don't want to start emitting rules other than saying one person.
Marco Bélair-Cirino du Devoir. Monsieur le Premier ministre.
Mr. Premier, do you regret having proposed your moral contract to Quebecers on the 19th of November last? Do you regret having given hope to Quebecers of being able to have gatherings during the holiday season? Well, listen, as I was saying earlier on before, I'm not perfect and I don't have a crystal ball. At the time that I proposed that moral contract, I was sincerely convinced that it was possible. We had given a big if the situation does not deteriorate. And unfortunately, the situation has deteriorated. So, of course, if we had to do it over again, I wouldn't. But at that time, I thought that it was the right decision for people to be able to plan, for them to have hope, and to help fix certain mental health problems as well, because we still have those problems right now. We have people who are tired, sick and tired, people who are anguished. We have people who would like to be able to see other people, so it's not ideal. But in the balance of inconveniences, today, with the information that I have now, I don't think it's a good idea that people get together at Christmas. Over the fall, we talked about the 28-day challenge and then the 56-day challenge, and now you're telling us, as the experts in public health are saying in the United States, that the upcoming 3 to 4 months will be particularly difficult. So are we talking here today about the 120 or 150-day challenge, or the rules that we have right now? Are those rules going to have to be followed for the next 4 months? Well, listen, I don't do a press conference once a month, I have one every couple of days. We're following the information, and we'll look at the evolution of cases, of hospitalizations, and we will keep you aware. But for the time being, when we look at the increase in the cases of the past few days, well, it allows us to predict an increase in hospitalization the upcoming week. So what we're saying here is there won't be any changes before the 11th of January, and by the 11th of January, we'll have had many opportunities of talking and getting together, and I'll answer your questions. If there's days that I'm not there, Christian will be doing it, and we'll inform you and keep you up to date. Our health workers, I think that behind the statistics, sometimes we have to take a step back and to, try to understand the difficult decision that we're making today. I'll just give you the example of hospitalizations, because we can see it every day. We say it's 5 or 10 extra hospitalizations. But the reality is that 80 people went into the hospital and there's like 70 who left. That means that every day, 60, 70, or 80 people enter our hospitals to get treated for COVID. That means that every day, our healthcare workers are caring for 80 new people. So now what we're saying is it's not just of adding, a net 10 people. We're not talking about net numbers here. What I'm saying right now is that right now we're doing this for our healthcare workers as well. And as the Premier said, it's been 9 months that they've been fighting. So when we looked at that, by taking a step back and we thought, well, I think that we have to give them that news 10 days earlier. And that is exactly what the reasoning is, because we're doing it for health care workers, and I think that they are the ones that have been, fighting for Quebecers for the past 9 months. And when we see how difficult things have been, if we could help our healthcare workers, the best Christmas present that we can give them is in the next months to make that effort, to make sure that we get to the best rate in January as possible. And that is what we're looking at, the efforts that will be made in schools and working from home, so that we'd be able to tell our healthcare workers, thank you so much, and we're going to try to be in the best possible position in January. Dr. Arruda, the Premier explained that this was a government decision, but from a strictly public health point of view, as far as you're concerned, it's impossible to redress the situation, the epidemiological situation before the holiday season? It would require monumental efforts, and when we look at the trend, and it's been a while, twice 28 days that we've been giving the same guidelines, so it's clear that the probability is lower and lower. Nothing is impossible, but when we look at people's behavior, when we also look at the fact that the present cases that we have right now, an increase, are going to have an impact in 2 or 3 weeks, it becomes complicated. We will now go to English questions.
Good afternoon, good day. I wanted to pursue on, in the first wave, we saw a lot of the calamity in the CHSLDs, and now we're seeing a lot more cases in private residences. I don't know, Chateau Westmount in Montreal, Bridget's home, various homes have been hit by the virus. And yesterday we saw in Alberta, Mr. Kenney thinking about asking for the Army and the Red Cross to come back in. Is there any thought of that in this situation, the Army or Red Cross?
First, I would like to give you a figure. When you look in CHSLD, compare fall with spring, there's a decrease of 90%, all right, number of deaths. If you take all residences, house, all other places except the CHSLD, there's a decrease in the number of deaths of 40% when you compare fall with spring. So both places, CHSLD and other places, we see a decrease. So the situation is better. Why is that? Many reasons. We have younger people involved. Second, people are more careful. They know more about the 2 meters of distanciation that they knew last spring. But it's not true to say that the situation is worse in normal houses. It's better. The improvement is not as great as in CHSLD, but there's an improvement also.
Okay. And there was a certain political risk in allowing, in promising Quebecers, even though you had the big if about Christmas, and today you have to backtrack. Is that a difficult thing to do? And there was a poll that showed many Quebecers didn't actually believe that they would be allowed to have gatherings at Christmas. So is there a price to pay for that for you politically?
What I'm trying to do is to protect as much as I can the population. And yes, there are some health, physical health issues, but we have also mental health issues. And I'm trying to do my best. Like I said in French, I'm not perfect. I'm trying to do my best. And sincerely, when we proposed the 2 days 2 weeks ago, I thought at the time that we would be able to decrease the number of cases, but it's increasing. But it's also, I have to say, increasing a lot more in other countries, like United States and Europe. So we're all fighting the same virus. we're doing better for the second wave than in the United States and Europe, but still it's increasing, unfortunately.
Thank you, sir.
Nous allons passer à Kelly Craig, CTV.
Good afternoon. Mr. Legault, you have said repeatedly that you always follow the public health recommendations, and it seems this time is a little different with, you said, public health said you can wait till December 11th and then make the decision. Why is this time different? Why are you taking the decision today?
Okay, first what I said is that since 9 months, I'm doing as much as what the public health is asking me. Sometimes I did more, closing stores, and in some different situations I did more. I just wanted to clarify that I didn't have a phone call from Dr. Arruda last night. It's the opposite. And I think right now there are many reasons for that. I think that I'm responsible for the message, and I want the message to be very clear. Right now, the situation doesn't look good, and it's not realistic that we'll have those 2 days at Christmas.
I also wanted to ask you about that interview and the perfect score, and if that was going to be an insult to people who died in the first wave that might be preventable because of certain measures. But since that is not the case, and you said, I maybe didn't think well enough, I will ask you now, how do you think you've handled this pandemic, and do you have any regrets?
Okay, first in the interview, I never said that I was perfect and that I had a perfect score. The journalist asked me what would have done differently. First, I said that I would have increased salaries for the préposés before the pandemic. But beside that, I wasn't able to find a place where, with the information I had at the time, that I must have taken another decision. I wasn't able to find one. So, but I'm not saying that I'm perfect because, and first, I'm not alone. We're taking this decision together every day. But honestly, even right now, except for the salary of the préposé, with the information I had every time we took a decision, I cannot see something that were done not correctly.
So just to be clear, the only regret is the salaries of the
It's not a question of salary. It's not a question of regret. I think that all Quebecers must have a regret not to have fixed the CHSLD problem for years, including my government. But we knew since many years that we didn't have enough employees in our CHSLD. I've tried to set the problem in increasing the budgets, but we weren't able to fill the jobs that were posted because the salaries were not high enough.
But those are the only regrets.
The only regret. With the information I have.
Katsuni, CBC.
Good afternoon. Do we have an idea about why the number of cases is rising at this point and why you had to take this decision? Do we have an idea? Do we understand? And that goes beyond community transmission. I mean, we are almost all in red zones and we're having strict rules. So do we get it? Why it does increase?
You know, the virus is... I know you want to perhaps not say that it's community transmission, but that's the case. It means the virus is everywhere. And as soon as you don't respect the 2 meters or those situations, which is reality probably, because that's true here in Quebec, it's true elsewhere in Canada, it's true in France, it's true in the United States. As it is invisible, people think, and it's very easy. People are washing less their hands, people are getting more closer, and when there is a lot of virus everywhere, the probability that an effect of no being compliant to the rules exactly will have an impact. And that's it. That's really the fact. But because in the springtime, everybody was home. We were not circulating. Only stores for essential services were there. So it lowers the number of contacts you had at that period. But now, that was wonderful. This summer, there wasn't less virus circulating. We had parties and things, and it doesn't flare up. But as soon as it gets more and more in the community, more you will have those things. And it's a sum of different acts which are not respected. It's why every effort you made is going to be all the small efforts we do that will have an impact on and even the vaccine is something great, but it's not there. And when we're going to have vaccine at the beginning, we'll still have to maintain those rules, because that's the only way to be able to put that virus beside us.
Premier Legault, I was wondering about regions during the season, the holiday season. And you say, well, it's not, we don't want people to travel from one region to another. Are you going to increase the number of checkpoints? Are you going to increase the number of SQ officers? And if you do you have some fears about the reaction of Quebecers?
But first, as I said, most of Quebec is in the red zone. So
even there, if they travel?
Maybe if you go to Chibougamau, you'll be... even Chibougamau is on the list. So I'll try to find another place.
But I'm just trying to see... The emotions will be very high.
Yeah, but
and if they see more checkpoints, and if they see SQ officers more on the road to say, well, where are you going? You're not supposed to visit your grandmothers or your grandparents in this region. Like, what's your plan? What do you imagine?
Okay. We'll have discussion with the police, different services. But I think the key will be to make sure that people respect the rules in stores, in homes, that you don't have gatherings. So I think it's more important that we put our efforts, that we put the police efforts in this direction than putting efforts controlling the traveling between regions, I think.
Raquel Fletcher, Global.
Good afternoon. I kind of want to follow up on that question from Katsi, but more generally, Quebecers had this idea that they were going to be able to have these two gatherings between December 24th and December 27th. Now you're saying they can't, but are you not concerned that they're going to go ahead anyway, that they've already made plans and they want to celebrate Christmas anyway?
But I think that people understanding the danger, understanding that they may infect people they love, they like, I don't see how these people, the ones that are responsible, will do that. But if some are doing it, we'll try with the police representatives to fight against that. But nobody wants to infect somebody else from the same family or some of their friends. So we'll have to explain the danger. And when I see the number of deaths in the world in the last few days, I still don't understand how some people can think that it's not dangerous.
EMSB has gone ahead and purchased air purifiers for their schools that don't have mechanical ventilation. The opposition parties say this is something that where your government dropped the ball because school ventilation should have been taken care of at the beginning of the school year. Now we're looking at a situation where, EMSB will have air purifiers, but other schools won't necessarily have them. Don't you think that the government should be providing this type of equipment for all schools across the province?
We gave 1.6 billion for the maintenance of schools to all the schools in Quebec. Right now, the public health doesn't think that it's absolutely needed to have purificator. So, like Dr. Arruda said, the situation can evaluate in the next months. The science can be more precise, but right now, what public health is telling me is that there's no reason to believe that there is substantial transmission of the virus because we don't have purificator.
C'est ce qui me fait un point de presse.
This puts an end to the press conference, and we thank you. Thank you, everyone.